Hi, Steve from Wandsworth Physiotherapy. So what is infra-patella fat pad impingement or Hoffer's fat pad syndrome? Well, the fat pad is in the knee joint, it's below the kneecap and it's underneath the patella tendon. And it's like a giant sponge inside the knee, and it's very rich with blood vessels and nerves, and it helps deliver nutrients into the knee. It helps to add congruency to the joint, and it helps to reduce friction of the patella tendon on the underlying bone. So that's its job, but it's a very irritable structure. Now, in some people, particularly with excessive hyperextension of the knee, they can irritate the fat pad. If you get a lot of direct trauma, such as falls and banging on the fat pad, that can irritate it, as can an occupation or a hobby that involves a lot of pressure and kneeling on the kneecap. Now, as I was saying, some of the textbooks say that this is the most pain-sensitive structure in the body. So goodness knows how they established that. So how do we diagnose the infra-patella fat pad syndrome? Well, it's very much a clinical diagnosis, what the patient says and their signs and their symptoms. So typically anterior knee pain that's aggravated by sport. And when we assess the knee, there may be a hyperextension of the knee, but it's usually very sensitive to press into the fat pad, particularly this superlateral part of the knee. We can ultrasound the knee and we can see the fat pad really well, but we can't diagnose much to do with the fat pad on ultrasound. But if you're wanting some imaging to help with the diagnosis, you would have an MRI, and that would show up the irritation in the fat pad. So what do we do to treat it? So it's an inflammatory problem, so we'll manage it in an anti-inflammatory way. So ice massage or simply just icing the knee regularly will really help. And what I do is I get my patients to rub in some Ibuleave or some Voltarol gel into the knee, into the fat pad after they've iced it, and I get them to do this several times a day. You have to cut back on some of the offending activities, whether it's kneeling or sports. And if you've got a particularly hyperextensible knee, you want to think about building hamstring strength to stop that knee locking back into hyperextension. Sometimes the kneecap position can impinge on the fat pad, so loosening up certain tight structures around the knee may help. And in some people with a particularly hypermobile kneecap or poor kneecap control, poor strength of the quads, what happens when the knee bends is it can sort of bang into the fat pad a little bit. So if we can improve knee strength, knee stability, that will also help to calm the syndrome down. Something that also helps is taping. So I would use K-tape. Some people use a rigid zinc oxide tape, and you just tape the kneecap up and away from the fat pad a little bit to help reduce the irritation. And I would do this just for running or just for sports and take it off other than that. Now, if none of those things are helping, then you could then progress onto an ultrasound guided steroid injection into the knee, and it will infiltrate into the fat pad and hopefully then also settle those symptoms down. So if you're suffering from anterior knee pain, or you think you might have infra-patella fat pad syndrome, come and visit us here at Wandsworth Physiotherapy. We can assess you, ultrasound scan you, diagnose you, give you the right treatment, and get you back to what you love doing.